Passion, imagination, wonder. These are just some of the words used to describe Dr. Harvey Passes. Dr. Passes explores interesting people and ideas that will stimulate you. He questions the people who develop, create, and employ novel concepts in business and everyday lives. He especially loves to speak with successful people. How did they do it? How can you do it too? So let's join Dr. Harvey Passes in his quest of wonder and curiosity as we watch Dr. Harvey Passes Presents.
I love doing this show. It is wonderful. It is fun. I get a chance to meet some of the most interesting people, and in turn, so do you. And I've got a wonderful guest today. You know, before I get to my guest, I'll give you a little background on how I got to meet her. One of the hats that I wear is serving as president of the Manhasset Chamber of Commerce, and I put together a great program at our library. And every month we have different professionals coming down to discuss various things that would be of interest to the community. And recently we had a program on how to have you learn how to select a doctor, a healthcare provider. How do you know you got the right one? And I met so many wonderful doctors, and one doctor in particular that I really enjoyed listening to her is a clinical psychologist, and it's Dr. Patricia Pitta, PhD, I might add, and she is terrific. First, you're going to meet her, and then you're going to love this program. It's exciting. It's wonderful. Dr. Pitta, how are you?
Hi, thank you. How are you? And thank you for having me.
It's great to have you here. It's great, terrific. And when I heard everything you had said and done and spoke about at our presentation at the Manhasset Library, I pleaded with you to take time from your busy schedule to come down here so that my viewer could gain a lot out of your pearls, your words of wisdom. So let's get down to it, and let me tell my viewer a little bit about you. And that Dr. Pitta is a licensed clinical and family psychologist. She's board certified in family and couple psychology. She is an approved supervisor with the American Association of Marriage and Family Therapy. And you're in private practice in Manhasset, where you treat individuals and families throughout the life cycle. You're going to learn about that, with specialization in child/adolescent dilemmas. Kids don't have dilemmas. What a joke that is. Couple and marital conflict. And I love this. The sandwich generation issues and anxiety. I know what that is. Depression and eating disorders. I get hungry when I think of that. You're presently the president of the clinical division of the New York State Psychological Association, and Dr. Pitta, which is you, held national and local offices with the American Psychological Association, Nassau County Psychological Association, American Board of Family Psychology, and the American Association of Marriage and Family Therapy. You've published many articles within your field of family psychology, as well as book chapters and videos for the American Psychological Association. My God, my jaw is falling off. And you're also an adjunct professor of psychology at good old St. John's University for the past 20 years. You don't look old enough for that. Okay. All right. So I think the show is over now. Thank you very much. So now, we're going to be talking about family and about things, because that's the whole thing. That's the main unit that we have as our family. What is a healthy family?
A healthy family is a place where people know their roles and their expectations. So if you know your role as a mom, a dad, a sister, a brother, and you have expectations that you want to meet, you have a kind of a platform in which to work from.
So let's continue in that same line of thought. I love this because I have this discussion with my kids, and they absolutely don't care, and that is boundaries.
Right.
So how does boundaries fit in with happy family?
Well, if you have healthy boundaries, and maybe I'll define what a healthy boundary is,
we'd
right?
like you to.
That means knowing your position around an issue, and that you cannot really be pushed or influenced unduly to change your position if you don't want to.
For example?
For example, say you have a teen.
A what?
A teen.
Okay.
And they want to go out at night. And they're going to the school dance, right?
I'm getting a twitch.
Okay, all right. It sounds familiar, right?
Yeah, give me the keys to the car.
Right.
Go ahead.
Well, okay, the keys to the car.
Anyway, but go ahead.
We'll go to a party, say.
Okay.
There's a school dance, and then the school dance is over at 10, and mom or dad says, you know, I'll pick you up at 10 o'clock. And the teen says, oh, Mom, I'd really like to be able to go to Jimmy's house.
Yeah, right.
Right? And Mom says, I really didn't have that in mind.
Right.
What happens is that if you have good boundaries, Mom can open herself and say, you know what, let me hear what you'd really, you know, what you want. Okay, you'd like to go to Jimmy's house. You say you'd like to go till 12. I'll tell you, let me call Jimmy's mom.
I love it.
And see if Jimmy's mom and dad will be home. And maybe if I speak to them and I feel comfortable with it, I'll let you stay till 11. Okay. So if you have good boundaries, you know what you want, and then you're even open for negotiation.
Negotiation with a kid? Okay.
Okay.
Now, what about creative discipline? And discipline's a big deal, and discipline is a gigantic, wide berth of a subject.
Right.
But let's talk about with your family. What is creative discipline?
Okay, this is a program that I created.
Let me hear.
And it's for parents. And there are several elements to the program, and I'll just talk about a few right now. One is the basis underlying most psychological problems is anxiety, heightened anxiety. So in order to be an effective parent, you have to be able to moderate your anxiety.
Meaning don't show it?
No, it means have it under control. So when your child is speaking to you, if you're immediately interrupting them and getting anxious and nervous or angry, what are they going to do? They're just going to withdraw, pull away, and then they're not going to talk to you. So first of all, you need to control your anxiety, okay? Then you need to be able to listen respectfully, just like you and I are now. We are giving each other eye contact. We are responding to each other.
Right.
I'm not talking over you. You're not talking over me. So you need to be able to listen, and then you need to
respectfully. I like
respectfully.
That. Listen respectfully. Right.
You know, many times it's not really what we say; it's how we say it. Right? Right.
Clean up your room. Clean up your room.
Right. And what does that do? Right there, that sets up
a wall.
A tension.
Right.
An anger, a frustration, and the kid is going to say, "Oh, really? He wants me to clean up my room? Forget about it."
Right. Leave your brother alone. Stop hitting your brother.
Right.
You know, please, it would mean a lot to me if you stopped hitting your brother. Big deal.
And also to respond respectfully. That's very important. And there is what I teach parents is, one, when a child talks, you listen, give them eye contact. Two, you repeat what they say in a respectful way, and then you respond. And what you're doing for the child is you're enabling the child to feel heard. If a child feels heard, he will be much more malleable than if not.
I'm going to ask you, when you repeat what the child said, I'm assuming you repeat it in the form of a question.
No, you could repeat it in the form of a statement. So, for example, if Johnny says to you, "Mom, I'd like to go to Jim's house tonight at 10 o'clock.
I hear a question back. You want to go to Jim's house at 12 o'clock?
No, I'd say, what you're telling me is you'd like to go to Jim's house.
And then, okay.
And then you would say, whatever your answer would be. So what you're doing is you're validating their question, that you heard it.
This is great. I can't wait for my wife to watch this show. Okay, this is great because she says, "Stop doing it."
No, what that does, that usually just sets off fantasies of rage and anger in a child, and they just close up and shut off.
That's a fact. Okay, now, the phrase I'm about to say to you, I mean, I've heard this phrase, and I've said it for years, and I think it was also said in a different way by the colonel on the bridge in the River Kwai. Be happy in your work, And that is, if you remember that film. But anyway, what about children being happy with who they are?
Okay.
Get into that.
Okay.
Be happy with who they are.
Well, you know how a child is happy with whom they are? Is when a parent accepts the child for who they are, with their limitations and with their assets. And that's really important. It's what you'd call loving unconditionally for who they are. That doesn't mean their behavior. You have to love everything about their behavior. But letting them know that no matter what, you're behind them and you will help them through anything.
Let's talk about, in that same vein, because we're really going down a path that's taking us to self-esteem. And self-esteem, what is it? Why is it so important in a child?
Okay, well, self-esteem lets you feel good about that what you are and that what you do. The bottom line. That's what self-esteem really is all about. And as parents, we have a job to teach our children about self-esteem.
How?
By the way we interact with them.
It's what you said a few moments ago. Speak respectfully.
Right.
Validation.
Right.
Let the child feel that they were heard.
Right.
He was heard. Okay. So
And also reinforce that which they do in a positive way. If they do something worthwhile of positive reinforcement, absolutely tell them about it. And if they do something that's inappropriate, tell them about it. And don't use the words good or bad.
I hate that.
Because all our children are good. Some of their
Their behavior is bad.
Well,
I won't say bad, but behavior is
it's better
poor.
to say inappropriate, because if you use those words bad, that really erodes their self-esteem.
It's interesting. Now, what does a parent do when the child just doesn't listen?
Well, I'm going to tell you that 99% of the children who do not listen because they don't want to listen. There's maybe 1% that have other issues like neurological issues, organic issues.
That's different.
That's different. But 99%,
Behavioral.
it's behavioral. They just don't want to listen.
What do you do?
Well,
I mean, electric prods and shocks and stuff?
Well, I have a program that I teach parents about giving positive reinforcement for that which they do. And the bottom line is that children have to earn their privileges.
Okay.
It's not a given. You have to earn everything you get. For example, if you're a dentist, right? A very successful dentist and a very good one by your reputation.
Right, thank you.
Yes. And if you went to your office and just didn't work, what would happen?
Calamity.
A calamity, right? How do children think they don't have to do their jobs? So what you do, what is a child's job? To get up in the morning, to eat their breakfast, to get dressed, to go to school, to act appropriately in school, to come home and maybe discuss what they did in school, do their homework, go out and have fun and play with their friends in an appropriate way, or to do their after-school activities if they're teens. And from that work, they earn privileges. TV, PSP,
Goes on and on.
going out with friends.
Right.
I don't use sports as a means of reinforcement because I think that's really important. Usually, when children are having problems in terms of behavior, they need that outlet to get that frustration out. So I would not say you can't go to soccer today. But in terms of going out with your friends,